So just as a definition so that you know what it is, vicarious trauma is a transformation in the helper's inner identity that affects you on both an emotional, spiritual, physical, and psychological level, that results from you listening to trauma content stories day after day while using the skill of controlled empathy. And it is a natural stress response that your body and your mind will have. And Ellie's going to give you a little bit of a background on what happens to you physiologically when you use the skill of controlled empathy and listen to trauma content stories.
When people suffer from vicarious trauma, you'll know, one of the ways you'll know that you're experiencing secondhand shock is if you ever start trying to be all things to your client. One of the things that happens when we are suffering from vicarious trauma is that our boundaries break down and we become at risk to start practicing outside of our scope of practice. So many times, because clients are very upset when they come to see you, where it's an upsetting situation they're talking to you about, and they're putting you on a pedestal as a professional, and you have heard a lot of stories that are horrible over time, your first reaction might be fight or flight, fight for your client. And so you may try to start managing your client's emotions, or trying to fix things for your client, trying to rescue your client, trying to go to bat for your client. You have to be very careful of that, because in so doing, you put yourself at risk to be practicing outside of the scope of what it is you do. And so you don't want to be all things to your client, and you want to know and be very clear about how to collaborate with other helping professionals who might be better suited holistically to be of support of you in your work with your client and to make the appropriate referral. That really to become better skilled at knowing when to do that is by having a sense of your witnessing position. When a client comes to you for a consult, you are in a witnessing position with that client. What that means is that you're listening to their story, you're paying attention to what their challenge is, and you're very, very present. And what you want to do is two dimensions to what you want to provide. One, you want to be very aware of everything that's going on within that meeting space, in that space, and you want to see yourself as empowered to help the client in the way that you are trained to help the client. But if you have secondhand shock, you're going to be at risk to move into these other three positions which can cause you trouble in the big picture. The best example I can give, and I'm going to go through it very briefly, when we have a longer period of time, we talk about this case with greater depth. But we worked with an attorney who came to us with secondhand shock, who went through a very upsetting case with a client. And the client came to him. She wanted a divorce. She came to him and she said, look, I want a divorce from my husband, and the reason why I want a divorce from my husband is I think he has been sexually inappropriate with our 2-year-old daughter. And I think he's been crossing boundaries, and I don't want anything to do with him anymore. I want to file for divorce. So when he first heard this, he thought, okay, not a problem. So he filed, helped her file for divorce. I think they even did an order of protection, and they referred the child to be checked to see if in fact there were any physical signs that boundaries in fact had been crossed. As the case went on, he kept doing what he was doing. What he was unaware of, though, was that this client had been herself a victim of childhood sexual abuse, where her father had begun crossing her boundaries from the age of 2 years old till about, I want to say, 11 or 12 for many years. He didn't know that. And so because he didn't have that key piece of information, a very important part of interacting with this client was missing, which would have been what? Well, I know we have some risk takers in here. What would you do if you knew that about a client that came to see you? What would you want? Empathy. You would feel for that client, and in so doing, what would you want to do for the client? What would you suggest to the client? Yes, you would probably make a referral for the clients to get some help and talk to someone who would be practicing in their professional scope, who maybe had some background and some training in working with adult victims of childhood sexual abuse. You didn't do that. Well, guess what? As the case went on, she had a memory that she herself was a victim of childhood sexual abuse, and she told him that that had happened. And he said, okay, but he really didn't make the appropriate referral at the time. So now he's very stressed that his client is having these horrible memories, and he's aware that she's in trouble, but now he's so far into it, and he has secondhand shock, the story itself adding to his own trauma, that he's kind of in a freeze mode and not doing what he needs to do to take care of the client. Well, eventually the client did get divorced. When the divorce was finished, she complained to the lawyer. At the end, guess who got the finger pointed to them? The client was very upset because she realized that maybe her husband never had crossed sexual boundaries with the child, that she in fact just projected that onto her husband because she was retrieving her own memory of childhood sexual abuse, and she was very upset that the divorce took place at all. Yikes. So it's very, very important when you work with clients as you proceed in your careers that you always pay attention to exactly where you're at in your witnessing position. And if you're not in position number one, the chances are you've got some of your own stress going on and you need to regroup. Maybe call in some support services for work with your client.